Hi, welcome to Healthwatch. I'm Cindy Berry from Ledgelight Health District. You'd think after 15 years that we would run out of topics to talk about on the Healthwatch program, but no. Public health is ever changing, and I'm so excited today to introduce the topic of breastfeeding with Jessica Seyfried. She's from Thames Valley Council of Community Action, and we're going to talk about a new program that's called New London County Healthy Families Partnership. So Jessica, thank you for being here.
Thanks for having me.
I'm so excited. I've been able to come to a couple of meetings and see what you guys are doing, and so I'm really happy to be able to introduce the topic and your partnership to the community. Let's talk a little bit about how it got started.
So TVCCA received a grant from the CDC, chronic disease prevention grant, aiming to decrease chronic diseases among low-income mothers and children. So our first step was to do a community health needs assessment, and among a couple of things, the top two needs we found facing our mothers and children in the county was it's difficult to access affordable and healthy foods, and there's not a lot of support for breastfeeding within our county.
Mm-hmm. So interesting, because that is exactly what your coalition decided to focus on.
Yes.
So let's talk a little bit about, I know we have kind of a ambitious agenda here today for the program. Let's talk a little bit about what the recommendations are for breastfeeding, because they have certainly changed over time.
Yeah, and so currently the American Academy of Pediatrics recommends exclusive breastfeeding for 6 months. So that means no formula, unless medically necessary. And then at 6 months of age, they recommend introducing some foods, but continuing to complementary breastfeed until 1 year of age.
Mm-hmm. So Jessica, what are some of the benefits of breastfeeding?
Yeah, so breast milk is alive, so it's flourishing with antibodies and nutrients from mom given to babies. So we see that breastfed babies are generally healthier. Mm-hmm. They have less tummy issues, less ear infections, they have less risk for developing asthma and allergies, they are at a decreased risk of SIDS, mm-hmm. and overall we see that breastfed babies have higher IQs if they can reach these breastfeeding goals.
Mm-hmm. So great, lots of nutrients and antibodies mm-hmm. to keep them well. What about chronic disease? Since this whole thing goes back to reducing and preventing chronic disease, how is chronic disease affected?
Yeah, so children who are breastfed are at a decreased risk of developing obesity and diabetes, mm-hmm. and actually some childhood cancers. Wow. So also delaying introducing food into a child's diet to 6 months is also associated with a decrease of obesity. Mm-hmm. And mom is actually less likely to develop breast and ovarian cancer.
Wow.
And moms who breastfeed, so this promotes bonding, and
mm-hmm.
they're at a decreased risk for postpartum depression. Mm-hmm. So that's huge.
It's crazy what we know now. You had also mentioned that there's some specific benefits for premature babies. Tell me about that.
Yeah, we see huge benefits for premature babies. So decreased risk because of these antibodies that mm-hmm. they're getting for developing, more acquired issues, but also necrotizing enterocolitis is common among preemies, and breast milk is proven to decrease that risk.
Mm-hmm. Wow, crazy. So I understand that there's some ways that women can actually share breast milk these days.
Yes, so breast milk banking is now becoming a big thing, and it's really beneficial in NICUs because of these preemies mm-hmm. who need all the extra help that they can get. So we're looking to open what's called a breast milk bank depot in the Norwich area. So the key is that moms need to be screened before they start collecting their milk, and the mm-hmm. breast milk bank will pay for all of this. It's like mm-hmm. a blood test and a couple questions. Mm-hmm. And then once they're screened and approved, they can start collecting their milk in the freezer and then drop it off at one of these depots, and the depot will ship it to the milk bank where it's pasteurized and then redistributed to babies who need it.
Jessica, I'm wondering how many women in Connecticut actually meet the standards? You talked about recommendations from the American Academy of Pediatrics. How are we doing in Connecticut?
So in Connecticut, 85% of babies are ever breastfed. So that means at least one time they've been brought to the breast. But only 21% of them are reaching the American Academy of Pediatrics goal recommendation of 6 months exclusive breastfeeding. Mm-hmm.
I'm wondering, did that surprise you or your coalition?
It surprised me, yeah, definitely.
Do you think it was higher or lower?
I was hoping it was higher, but I think it really motivated our coalition to say, okay, we've got to be able to make a change here.
Yeah. So with only 21%, did you set a goal kind of somewhere in the middle? Seems like you could have a really high goal if you're trying.
So Healthy People actually sets goals, but within the state of Connecticut, we are just looking to increase the supports. I mean, we're only a 15-month grant, but we hope to see a bigger difference once the grant is over with all the supports we're setting up.
So one of the reasons why I was really glad that you were coming on today is because it just seems like in our day, now in our society, we have so much information. And it's almost information overload.
Yeah.
You know, and the words like fake news have been kind of circulated. And it just makes me wonder how much information is really accurate and up to date. And you have some sites actually that are really good for women who are looking for information. Where would you recommend people go?
Yeah, so womenshealth.gov is a great one, and of course the CDC. But actually WIC, which I think surprises people because often WIC is seen as the people who give out formula, but that's not the case. I mean, WIC they're great breastfeeding advocates. In fact, TVCCA's WIC program just received the Loving Support Award, which means they're one of the best supporters of breastfeeding within WIC agencies in the state. So.
And
they're
real
doing
quick,
great work.
What is WIC?
Women, Infants, and Children. It's the supplemental nutrition for women, infants, and children.
Okay, great. And what kind of support do we have here in New London County? You mentioned support.
Sure.
What do, you know, a woman who's deciding to breastfeed or having her first baby or a new dad that's a little bit nervous, what can people count on in terms of support?
So first and foremost, we encourage women and dads and family members to talk to their obstetrician. And before baby is born, learn all that you can about breastfeeding and talk to people who have done it, because it's not easy. It's worth it, and you can do it, but it takes a week or two to really get going, but it's worth the effort. And also obstetrician offices are starting to open up breastfeeding clinics within their offices, so once you have delivered, you know you have that support. And also we encourage women to interview their pediatricians beforehand and ask, are you promoters of breastfeeding? But also say, do you have any CLCs or IBCLCs? And these are certified lactation counselors and internationally board certified lactation consultants, on staff, because then they're there for you when you're at an appointment to get some help. But also a lot of what our grant is doing is working on these breastfeeding support groups. So each hospital so L&M and Bacchus has a support group during the week led by their IBCLC. And then a lot of them are popping up through the support of this grant, and just because, agencies are realizing women need a little extra support with breastfeeding. So Navy Marine Corps Relief Society just started a group in Groton. Catholic Charities has a group in Norwich and New London. La Leche League is in Gales Ferry. Breastfeeding USA in Colchester, and TVCCA is really excited to announce that we just are starting up Connecticut's first baby cafe. So this is a model that moms can just drop in at any time, hang out with other moms going through the same thing, but also on staff at these groups are IVCLCs and CLCs, so you get that professional support and that peer support at the same time. So that's starting February 27th, and that will be Mondays from 1 to 3 at Otis Library in Norwich.
That sounds great.
We're so excited.
That sounds really great. A whole different approach. It's almost kind of like that whole meetup approach.
Exactly, that's the model.
Just meet up over something that we have in common.
Yeah.
That sounds really great. So we have a couple minutes left in this segment. Let's talk a little bit about your nurturing tents, because that's really amazing.
Yeah. So that was donated through a couple organizations within our county, and it's this bright red tent, so you won't miss it. And we've been bringing it to your farmers markets and to other community events as sort of this safe, kind of private space to feed your baby, change your baby, whatever you need, just to help normalize breastfeeding, because it's okay and it's safe to do it in public, but you know, we always get some feedback, so this is just a little private space where moms can feel comfortable.
It's great, especially with so many different cultures in our community. There are different levels of privacy that's needed, and I think that it's really nice to have. You also have information there about breastfeeding that people can pick up.
Yeah, lots of resources, and we encourage all the local agencies to, it's free, borrow it from us and set it up at your
Oh,
event.
that's great.
Yeah.
I didn't know that. That's great. So, Jessica, why don't we take a break, and then we'll come back. When we come back, we'll talk a little bit more about your work site, breastfeeding policy initiative, and find out how people can reach you.
Great.
Okay, we'll be right back.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
I'm a single mother, and I was the main one working, so I never thought that I could go back to school, you know? My sister, my mother, everybody wanted to help me with my kids. I could not have gotten my diploma without my family.
Find free adult education classes near you at finishyourdiploma.org.
Welcome back to Healthwatch. We're talking today about breastfeeding and the recommendations that are coming out of the New London County Healthy Families Partnership with Jessica Seyfried from TVCCA. Thanks so much. We left off talking a little bit about some of the support system. Let's talk a little bit about something that is brand new to our area, in that it's your policy work around healthy work sites, right?
Yeah, so we're working with companies, agencies, organizations to help moms transition back to work if that's what they would like, by having breastfeeding friendly work sites. So what this is an organization writes a policy into their HR manual that says women within 1 year of birth, women are entitled to space, which is private and not a bathroom, and time, flexible break times within their workday to express milk.
Mm-hmm. And so what are you hoping that will do for breastfeeding moms?
So if an agency does not have breastfeeding friendly worksite policies, the retention rate after maternity leave is 59%. So by implementing a couple of these policies, the retention rate after maternity leave jumps to 94%. So it's really great for the business, but it's, as we've been talking about, really great for mom and baby as well.
And what are you hearing from mothers? What are you hearing about the challenges that they have going back to work, and what are some of the things that are getting in the way as obstacles? Yeah, so
it often is a sort of this time when women feel that they need to give up breastfeeding. So, you know, there's lots of childcare programs who are willing to provide mother's milk in place of formula at sites, which is, I think, the feedback that we get that moms are afraid will not be the case. So giving moms the opportunity to express this milk because, you know, the milk needs to come out when it needs to come out. So by allowing women to do this at work and then storing the milk and bringing it to their child's daycare provider, women are a lot less stressed about feeling that they're providing for their baby.
So the benefits to the employer, what are some specific benefits?
They're huge. I mean, that retention after maternity leave, reduced absenteeism because, as we mentioned, breastfed babies are healthier. Increased loyalty and higher productivity for mom because she's not worrying about all these other things at home. Less turnover and therefore not having to retrain employees, which is time, and searching for new employees, which is so time consuming.
Right.
And you get to keep your institutional knowledge inside your agency, which you've worked so hard to build. Reduced healthcare costs for mom and her family when they have to go to the doctor, but also on the employer's end, the premiums are going to be lower. And so it's a 3-to-1 return on investment. So it's so beneficial to both.
That's great. And you mentioned that there is a law. Actually, there is a law. What should employers know about that?
Yes. So all employers need to look into this law, depending on the size of your agency. Certain laws will apply to what you need to provide for moms. So it's a Connecticut general statute. It's called Breastfeeding in the Workplace, and we are here to support moms or employers as they're looking into this.
Wow, that's great. So my guess is not very many employers have this breastfeeding friendly policy.
So we've been doing a lot of outreach to New London County businesses, and we find that surprisingly a lot of businesses have already done this or are willing to support this, and so we're just here to fine tune it and have them submit their policy to the Connecticut Breastfeeding Coalition to be recognized as a supporter of breastfeeding and a supporter of our community and the work that we're doing. So it's breastfeedingct.org. There's a little pink button on the top where you can submit your policy and be recognized.
Has this surprised you that so many businesses already have this in the works?
Yes and no. I think that a lot of employers are willing to support their employees, which I like to think is the norm. But with it being a law, I'm not surprised to see it in too many places.
Yeah, and you even have some sample policies to get people started. What else do you have?
We have a whole toolkit. It's not this big. It's about 5 pages, and we come out to your place of business and we give you our 20-minute pitch and we walk you through any questions that you have, and we're there to support you through the process to make it as easy as possible.
Great. And then do they have some way of being acknowledged for this change?
Yes. So the Connecticut Breastfeeding Coalition, when they receive this online free, super easy application, will send you a little award that you can post on the wall, and then they'll notify us and if you're in New London County, and we are doing some press releases and stirring up some business for you just to recognize you as well.
So one of the reasons why I really wanted to do this program and interview with you is because I'm wanting to encourage employers to contact you.
Yes.
This is a kind of a limited project. You're really trying to get as many businesses as you can
by May 19th.
Right now.
Yeah.
You've already have a few. Who are some of the businesses that have contacted you?
Yeah, so Uncas Health District, actually they were one of the ones who already had it on the books, and so we're just working with them to finalize that, and Ledgelight Health District, of course, UCFS, and we're working with a couple private businesses as well already. So it's getting a lot of traction, and we're very excited.
That's great. And so again, where people can go for the policy?
So probably the easiest way to get in touch with us is through our Facebook page, TVCCA Breastfeeding Community.
Great.
And there you can find my email address and my phone number. Please give me a call, send me an email, and we'll set you up with everything.
Okay. And why should we, in general, I think, just advocate for breastfeeding? I mean, I'm a grandma. I'm a new grandma.
Congrats.
What can people in the community do to advocate, and why is that important?
So I want to read this so I don't mess it up. But
Okay.
if 90% of women were able to achieve the recommendation of exclusive breastfeeding for 6 months, it is estimated that $13 billion in pediatric healthcare costs and over 900 lives would be saved annually in the United States. So that's huge. But also, I mean, it's going to make for healthier communities. If moms and babies are healthier, our communities are healthier. It promotes family bonding, which in this age of technology everywhere, any moment to settle down and be with your family is wonderful. It's eco-friendly, and it's free. So it's really, in our opinion, worth supporting, and we're here to help.
So what have some of the challenges of this project been for you?
Really just timing. I mean, it's a 15-month grant, so it's really fast. And, you know, instituting policies in workplaces is time-consuming. So we just hope that we can create this sense of urgency that we're here to make this easier on you if you do it now.
And
it's worth
who
it.
have been some of your partners? I know that you've worked with the VNA.
The VNA is a huge supporter of our work. Department of Public Health, and then our local health districts, Madonna Place, UCFS, Catholic Charities. I mean, pretty much any agency in our region that is working with mothers and children, all the daycares, Head Start, they've all been really wonderfully supportive and really made this work move along in our short time period, and we're so thankful to all of them.
So you were able to, in the last, about a year, really do a needs assessment, get a lot of surveys back, convene your group, get your partners together and convene your group, and then really go through a strategic planning session to figure out what it is that you wanted to do.
Yeah.
How are you going to evaluate the success of this?
So the Baby Cafe will live on, and a couple other things will live on. And one of the great things that we liked about Baby Cafe is they have evaluation built into it. So they provide us with data collection and data analysis tools. So we will see of the women that join us at the Baby Cafe, you know, why they're there, what they need help with, and those kinds of things, along with all our hospitals and all these other partners, will inform us on what moms need, and we can work with our providers to give that to them.
And I know that you're new to public health in some ways. This has been one of your very first big projects.
Yeah.
What's been the most rewarding for you?
Just working with all of these partners who are so passionate about helping mothers and children has been so inspiring, and I think sort of the gas that keeps me going when it gets tough, because as with these projects, there's always, it's tough, but it's worth it, and having these partners supporting us is great.
Yeah, it's pretty infectious, I think, of other people's enthusiasm.
It
so
is.
That's very cool.
And you have been a great supporter to us, so we really
thank
appreciate
you.
that.
And thank you for being here. Thank you for being my guest. And please contact Jessica if you'd like more information about the coalition, what the coalition is working on, and certainly their baby-friendly worksite policy. Thank you for tuning in today, and have a great day.